I am Sheela Roth, Head of Clinical Education at Pearl. I'm very excited to be here. I'm a hygienist, and my real passion is practice growth. I am joined by my fellow Pearl cohort here, Kimberly Quishin. She is our Director of Growth. And we have our wonderful SOTA partners on our webinar tonight. Very happy to do this together. We do have Frank from marketing, as well as Scott Cote, the Director of Sales. And joining me tonight, along with the webinar, we go back a little ways now. We've been working together for a while. Therese Negron, she's also our account executive from SOTA. And Dr. Kagan. So Dr. Kagan and I met, how long ago was that? Maybe like 5 years, maybe 8 years ago?
Longer.
Longer, yeah. We've known each other for quite a while, kind of running into each other in different places, different webinars with a marketing company that we both had used in the past and currently, as well as when I first saw Dr. Kagan at the CDA, he was really excited about AI. And then I saw him again at another webinar, another seminar, and he kept talking to me a little bit more about how he's really using AI in his practice and SOTA Cloud and how he just loves it. And I'm like, I'm bringing you on stage. So I'm really thankful that he's here tonight. You've been practicing for a long time. You've been kind of a celebrity on a lot of these CNN, MSNBC TV channels. I know how fond you are of spending your free time with your wife. And in dentistry, I loved the part that's talked about how you personally examined over 3 million teeth. That's very interesting. So has also the founder of the dental care of Boca Raton. And also, Dr. Kane, is there anything you'd like to add before we jump in?
No, you've done a great summary.
Okay, excellent. So I'm going to go ahead and share my screen. I do want to go over a few little housekeeping items. We're going to have a nice kind of our first Pearl After Dark, we're calling it, a little more conversational. So again, we'd love for you to unmute. Teresa's also going to be here with us to kind of jump in for those SOTA questions. We have a CE for you at the very end, so be sure to stay and get that QR code and a few additional things as far as like if you'd like to talk to SOTA Cloud or Pearl, we're going to be able to give you ways to do that. So I'm going to jump in and share my screen, and we are going to get started. All right. Okay, so really, I also think when we kind of talk a little bit about AI, we're going to be bringing in kind of how Dr. Kagan has been able to not only help his team be more efficient and effective, but also how he's done such an incredible job and is inspiration to me of being able to free up his time, manage from afar, and spend time with his son, his wife, and also grandson, I think, right?
That's
Yes.
right. We were just on with him a minute ago. Yep.
It's really kind of inspiring to be able to see where we can take dentistry and be able to still maintain a practice and live thousands of miles from it and be able to still be able to treat patients, oversee it with AI, and find ways to streamline things. So we're going to talk a little bit about what AI is today, how it came to dentistry, some of the chairside impact of AI, the clinical performance, and really kind of where is AI heading in the future. So again, our mission at Pearl is to really impact billions of patients' lives by elevating that standard of care in dentistry. I think in this space that we're in, the way we do dentistry now is so different from a insurance perspective, time perspective. We have this mass exodus of dental staff members leaving the space and this shortage. We're all trying to find hygienists and doctors and stuff. But at the same time, we all went into dentistry for that main reason, which was to help our patients. And tonight we're going to talk about ways to be able to do that. When we think about AI, I just want to make sure that you have in your mind what that looks like on a daily basis. And Pearl does have the largest array of radiological capabilities in the space. So from pointing out that periaporeal lucency to the notable margins, bone level measurements that alert your hygienist to take a closer look from a periodontal perspective. We'd like to see white, not yellow or even red. Calculus, great thing to hover over and have those teams understand when they're explaining to the patient, you have some help here. And then again, we'll get into this a little bit later, but my favorite is on the far right, where you can really take those case presentations to the next level by using those color-coded visual aids for the patients to understand and accept the dentistry that you're recommending on a daily basis. Our goal is to not have you diagnose more dentistry, but that your patients would actually accept the dentistry you're recommending kind of earlier and more often. And some of the things you'll hear me kind of inject throughout the presentation are from a lot of webinars we've hosted and a lot of consistent questions in clinicians' minds, like what happens if you overlap or if you don't take the right angle. And I think the concept is very similar for an AI reading radiographs as it is for a human. So the more accurate an angulation the radiograph is, as well as the exposure, the more accurate the AI will be. So, excuse me, again, thinking about how incorporating AI into your space, I want to make sure you're aware that this happens in real time. So if you take 4 bite wings, this is automatically uploaded. You don't have to do anything different. The images will appear with those AI detections so that if your hygienist is taking them or your dental assistant, the doctor comes in, you could view those images right before you pop in, or definitely chairside with your patient. So when we look at areas of decay, we're going to color code those from a light pink to a dark pink. And as they move through that DEJ, they become darker. Excuse me. So when we colorize the teeth, that's when we'll talk a little bit more about the chairside case presentation. Now, the interesting study on the right, I want to kind of dive into that a little bit because it really kind of is going to fuel like the why AI, right? Why do we need AI, Sheela? And when we look back at Pearl studies for our FDA submissions, we found that the AI reading the radiographs, they did a great job, not perfect. We also found that the dentists reading the same radiographs and circling cavities and being able to help initiate those trials, great, not perfect. But the interesting research was when we put them together, we found that 37% more disease detected, and that's earlier in the space. Thinking about that humans can see about 30 to 50 shades of gray, whereas the AI can see about 550 to 700 shades of gray. So thinking about, okay, great, we can look at areas we can remineralize and areas that maybe we want to point out to our patient that we're going to keep an eye on these light pink ones until next time. But that the areas that we just shown earlier here, a darker pink color is a warning sign, right? Let's take a closer look at that. So that's a nice space for your x-rays to start moving into, allowing you to move through x-rays faster. So now that you understand what we're talking about with radiological AI in the dental space, let's back up and talk a little bit about what is AI. AI is artificial intelligence, right? Most of us have heard of what AI is, but don't really understand what it is and how it got into dentistry. So this is the basic definition, and I want you to think about simple things that we have in our space, in our world, that AI has kind of snuck up on us, right? We have facial recognition, we have natural language processing, so when you open your phone, right? When you have a bank fraud alert. So AI has been in our world for a very long time. And I think the other thing is that there's a lot of fear around AI, right? People think that it's going to take our job. It's scary. We see Elon Musk's robots. although I do think it would be great if it could make dinner, right? That would be nice. But we're not at a place where it's going to be solving math problems or really kind of thinking for us. It's able to be programmed, but the AI that we're fearful of, that we're seeing here, is more of a general artificial intelligence, right? We call that a strong AI, where we could actually have it think on its own, or like I was saying earlier, do math problems. I don't know that we're ever going to get to a general artificial intelligence application in my lifetime, but I'm thinking that's actually what people are very fearful of. When we look at radiological AI, we're talking about the narrow artificial intelligence. So simple systems that can accomplish specific tasks, right? And it does not think for itself. So I want you to think about, and maybe Dr. Kagan, with your grandson, like when you see a dog walk by, right? And you say, doggy, that's a dog, or that's a dog, or that's a puppy, right? And children start learning that because we point it out to them over and over, right? And the dog might be far away or close. It might be large or small. And that's very similar to the AI we're talking about when it comes to pathology recognition, right? Think about it has to learn shades of gray and how much data it needs to start identifying that's actually a cavity. When I look back at how far pearls come, there were areas where we would see cavities up in, water dots, and it would circle those as actual areas of decay, which it did its job, right? It said, hey, this area does not look like other shades of gray. But we really had to really focus on so much data to make sure that it was very narrow-minded and could consistently repeat the same indicators over and over. So we look at that as something like the chess robot, right? Where this little robot could actually beat this person in chess, but again, it couldn't go off and make it dinner afterwards. So as we talked a little bit before about AI and how it's really kind of snuck into our world, I think it was 44 new football, or I don't know if they're all football, but basically 44 stadiums in the US next year will have basic facial recognition, which is a form of AI. It's computer vision, right? Where you'll be able to walk into the stadium. You will not need to have your ticket or your wallet, and you can buy a hot dog. I thought this was an exciting story until I know Kimberly's not on, but she was telling me, yeah, I go in, that's how I do my groceries. And I'm like, I'm already behind the scenes and I'm behind everything already. But this is how AI is really coming in to do some simple, mundane tasks. We think about how many times have you used navigation, right? And do we always listen to it, right? If I turned left every time it told me to turn left, I probably would have hit a lot of walls or strange things, or couldn't turn left anymore because that street doesn't exist. So there are times where we see, AI not being perfect, similar to humans not being perfect, right? But as we see in our regular AI world and in dentistry, we are better together. I'm thankful for natural language processing, chatbots. ChatGPT is a lifesaver. And then also predictive data analytics, those bank fraud alerts, forecasting. Think about how it would be if it could forecast this like E1, E2 lesion. Should we wait? Should we fill it? The more data we have, the better we are prepared to make an informative decision, take better care of our patients, right? So if you start looking at AI in medicine, you can see how it's been here for a while, and all of the incredible things that we've moved from automation into innovation, right? Where we're looking at a patient being able to think about and mimic the hand movements, and then across the room there's fingers moving on somebody who's lost an arm. Like, there's a lot of really incredible things happening where AI can really enhance our lives. So why dentistry, right? How did it get into the dental space? And really, we have to think about the history of modern dentistry and how all of these technological innovations have really kind of pushed our industry forward and shaped the business aspect of dentistry as well. We'll talk about x-rays, right? Remember dipping those into the developer and fixer, and moving into when they got a real processing radio x-ray machine. I was like, wow, great. Okay, I can put them in the little holder. And then now we have AI, also fluoride, implants, digital dentistry, scanners and aligners, right? And we really consider AI being that huge pivotal moment where we do think that it will become the standard of care over the next 5 years. You know, you'll come in the morning and turn on the air, water, suction, AI, and that will become a part of our day. We do see that being an essential utility. This slide is interesting because we used to say the next 5 years, and it is really coming into the space a lot faster than I actually anticipated. As well as noting that patients would like to be in a practice. 87% of patients would like to be in a practice that has the latest technology, right? So that's a very interesting statistic. We do know that it is an inevitability that's not yet widely distributed, but we see that improving and increasing on a daily basis. So why is dental a really great place for AI? Because of the giant amount of images that we take throughout the year, right? 1.4 billion dental x-rays are taken in the US. And we can see compared to other medical fields, those account for about 10 to 15%. In dentistry, most patients, about 86% of patients, are actually having radiographs performed on their routine visits. So we can see that dentistry is a great space because we own the majority of the space for taking radiographs. We also look at this is probably exactly why dentistry is leapfrogging the rest of medicine when it comes to the AI space. There's another staggering situation we are all dealing with in dentistry, and that is still the clinical inconsistency. And we look at the numbers in these different studies and we talk about, you know, when we go from the Reader's Digest study and the dental AI company, the Dental AI Council that was formed with Pearl and other clinicians, very similar studies in 1997, as well as back just a few years ago, showing one x-ray to multiple different doctors, a full FMX, and you're seeing that the consistency of agreements on one area of the mouth, how often they agree if there's a cavity there, as well as the actual treatment presentation ranging from $300 to $36,000. That's still happening on a daily basis. All of you have probably seen second opinions, right? Walking into your practice. There's a UCLA study that they recently completed, and now UCLA has adopted Pearl into their curriculum. And I think for me, the most interesting one was when we took 9,000 images and we gave them to 3 different clinicians, experienced clinicians. One was a radiologist, and they looked at all the same images. They only agreed 4% of the time if there was actually decay there. But what was even more surprising was that when they looked at the same images 90 days later, they only agreed with themselves 70% of the time. So we do know that we still have this clinical inconsistency. And although we want to be different, it's also very challenging for a patient, right? We can think of in our own practice, like maybe I would do a 3 surface filling and maybe another doctor would do an onlay, right? And that's a very big difference in cost. And both doctors are probably right. But this is where we want to really kind of help patients bridge the gap when we're presenting dentistry. Unfortunately, we still have 40% of Americans that are not trusting the dentist. And that's not a number that's going down anytime soon, unfortunately. And then the 64% that say that they don't understand their x-rays during a consultation. That means that, you know, out of 10 patients you're seeing, how many people are walking from the back to the front going, what did they just say? I think I'm just going to wait until I come back for my cleaning next time, right? And we're still kind of presenting cases when we need x-rays the same exact way, right? Showing them the black and white images and knowing that trust is kind of the #1 reason, according to the recent ADA study, why patients stay in their practices. So we have to look at the data, right? We have to align with what the consumers are telling us so that we can continue to be informed and deliver the very best care, and also make sure that our patients trust us, because then they're retained and they refer their family and friends. I think we could all agree with this statement, right? That the quality of dental care, obviously, it begins with that initial radiographic analysis, right? And we want to make sure that we are doing the very best we can when we're reviewing x-rays. So what does that look like when we're talking about building trust? And how can AI help build trust? Well, the nice thing about AI in the radiographic space is you don't have to worry about any change management. We're already taking x-rays. We're already showing them when it's applicable to that treatment presentation. And now we're going to show them in color, right? It's kind of like we don't explain to a patient that they need a distal occlusal class 2 surface composite. We tell them there's a little cavity on the back of your tooth. We're going to need to fill that, right? So now with teams that are using AI, chairside, they will see a 30% increase in case acceptance in the first month. Now, AI is not perfect, the human is not perfect, but we know that together we're better. And one interesting story was I was talking to one of my doctors, and I said, "What do you think of the AI? How's it going?" He goes, "Yeah, it's a great tool. It reminds me of certain things. There's things that it finds, there's things that I find, but I'm glad I have it." But I said, "Well, what do your patients think?" And he's like, "Oh, my patients, I didn't share it with my patients." And I said, "Yeah, that tool called the tooth parts where it colors everything." And he's like, "Oh, okay." So I said, "Call me back later tonight. Let me talk. I want to hear about what your patient said." He goes, "I couldn't believe it." And he said, "You know, Sheila, I'm saving so much time explaining shades of gray chair side, and I'm now able to spend more time answering questions about the treatment that I'm recommending." So it's giving us back some time. It's giving you more data, right, to make those decisions faster. And it's also allowing your patients to understand what you're talking about in color, right? Those simple things about like, can you just put a filling around the existing decay that's on that tooth? Why do I have to have a crown, right? Well, because we don't want it to crumble. But when they see that in color, it's a different story. All right, we're going to play a game. We're going to look at this x-ray. I'm going to give you about 30 seconds. I'd like to see how many areas of decay that you see. I want to have you put it in the chat, and I'm going to give you about a minute. Now, remember, I'm not asking you which teeth you would fill. I'm just asking how many areas of decay you would see in this radiograph. I don't see anybody in the chat. I should do like an Amazon $100 gift card. I don't have that today, by the way, but next time. Okay, the chat's on fire now. It's going, it's going. Okay, I've got 3, 4, 4, 4, 2. Okay, let's see. Another one, 7. Ooh, Julie's on it. Okay, the great reveal. All right, so, and you guys might also disagree, right? But I also want to show you that we all feel completely different, and this proves our inconsistency. Not always a bad thing, but it's also very confusing for the patients too. Would it be nice to have another set of eyes when reviewing x-rays, right? Now, a lot of people will say, well, I wouldn't fill 28 and 29. Good. We do not want that. We do not want you filling areas that maybe you don't need to fill for a few years, or maybe you could remineralize them. But also, what about number 30, right? We need to think about, do we need to have this conversation? I guess we could also do a poll, which I won't do because I want to make sure Dr. Kagan has some time to answer our questions. But how many of you would do a root canal crown buildup on that tooth? Or how many of you would just do a new filling crown buildup? So there's a lot of things that you can go from a filling, a redo filling, hopefully, maybe not. I'm not a dentist, but that looks concerning. But also a crown, 1,500 maybe, versus a crown and a root canal, maybe double, right? So this is where these visual aids would be helpful for the patient to understand. We want to get it before it hits the nerve, or we need to get it and we need to root canal because it's going to hit the nerve. But it also helps explain, like, we're not going to have to worry so much about these questions about why can't you just do an existing new filling? I mean, do a new filling around the existing one. And also, maybe we'll wait on these for now. Let's take a look at them next time. But the darker pink ones, we need to start thinking about for sure the lower right one, and then maybe also number 6. This was another interesting area, right? So did the AI pick that up or not? Or is that a liner, right? So there's a lot of different shades of gray we're working with when the AI can see 5 times the amount of shades of gray. So again, calculus. We either talking about interproximal lesions, we're talking about periodontal concerns. So we all know, I won't make you do anything with the calculus test because I know it's getting late, but we all know that there's areas of calculus. We can see these from, 2 operatories over if we see this image up. But thinking about your hygienist explaining asymptomatic foreign terms, Trinice, you need to have 4 appointments and we need to get you numb and we're doing some scaling and root planing, but don't worry, we're going to save your teeth, right? I mean,
Right.
kudos to hygienists, right? To be able to explain these things. But when we can hover over and show them the calculus instead of trying to talk about cowboy spurs and such and holding up, pencils, this is where the bone level should be, this is what it
Finger.
is, right? Exactly. These are the things that are starting to help the patients have more conversations. And again, why we all went into dentistry was to have the patients accept the dentistry that you guys are recommending. So I'm going to tell this quick story, and then I'm going to kind of have Dr. Kagan jump in here. But this was my best friend's daughter, and she was at a pediatric office, and she said, Sheila, I'm not understanding why your old practice is telling my daughter that she has so many cavities. She's never had a cavity before. So we took some bite wings, obviously. And I said, well, I'll meet you at the office. Let's chat. We'll get some coffee and we'll talk about it and see. I'm like, my office is not unethical. So let's take a look. And we can all see these cavities, right? And I thought, oh boy, this is going to be a really sad story for her. But think about how much faster it is to decide, am I going to fill which ones, right? Maybe I know for sure now that 30, that distal is a concern. Looks like the MOD on 30 is actually a concern, right? But isn't it nice to have just a highlight? Kind of like when you're writing a document and you can have spell check, a little red to underline like those little errors. This will help you navigate through your diagnosing a little bit faster. And it also is going to help you to look at areas of concern in a way where you understand them and explain them, but now the patient understands them. Think about the amount of time you will save in discussing treatment compared to the amount of time the patient can actually ask you questions. Well, why do I have so many cavities? How am I going to fill them? Why are you only filling maybe 2? How long are we waiting to fill the rest? What do I do so I don't get any more? There's so many conversations to have. Really, the most important thing is, how do we prevent this in the next 12 months when they have to change their habits or they're going to be back here? But this is really kind of the value of allowing you to have a tool that's going to be a built-in second opinion. We're all aware of diagnosis fatigue, right? And also the great way to be able to share this chair side with your patients. Okay, Dr. Kagan, here we go. So basic question for you is really, how is it helping you or your team when you are discussing, some of those concerns with patients, like they come in every 6 months, they won't actually get their treatment done that you're recommending. And do you have any examples of how using this chair side has been helpful for you with either patient trust or a new patient or even improving your case acceptance? I think we have you on mute. Sorry. Hold on a second. There you go. Okay.
Okay, so something that you just showed on there In the past, we've had to use diagrams, models, other types of software, but none of it was interactive with the patient's own images. So the first thing I would say is just like you show on this image, you can turn on these features, what shows you the anatomy of a tooth, where the bone is, where the calculus is, where the enamel and dentin and pulp is. And so, but it's showing them on their own teeth so that it's not some abstract thing for them. That's the first thing that just like kind of just jumped out on me. Just using that term, an unbiased second opinion, I think there's validity. It's used in all forms of radiology now, so people kind of expect it. I really think, and so yeah, and kind of like you said, I could be jumping ahead a lot right now, but as you said, the AI isn't perfect. Dentists aren't perfect. They disagree with their own diagnosis, but together it at least alerts you to, okay, is this something that needs to be addressed or is it not? And that's where I think it's extremely helpful, especially for younger doctors who may be busy. They're doing a lot of different things at the same time. It just brings their focus to something, and then they get to determine is that something or is it not?
That's excellent. Thank you for that. Yeah, and I think that, I don't know if this is the actual number right now, last time I looked, but there's like 190 oral maxillofacial radiologists, right, in the United States. And when we think about in other medical spaces, there's a lot of radiologists. I don't know the number, I need to look that up. But it'd be one thing if all you had to do was review images in a room by yourself with all of your imaging, functionalities you have, like SOTA Pop. I love that little feature you guys have to make things so clear. And then you could just ship off your diagnosis and have another doctor perform. And in dentistry, not only are you the radiologist, but you're the clinician. And not to mention you're ordering supplies, checking patients' teeth, you're the owner, you're hiring, you're firing, you're doing payroll and taxes, right? So it's very interesting when you think about how the dentist has to really have such a keen way of focusing on doing radiograph review. And I don't know about you guys, but dentistry isn't getting any easier. So having a second set of eyes behind you is really very helpful. So again, we look at basic areas of decay, interproximal lesions, simple lesions that patients deal with on a daily basis. I love this one because although we talk about how the x-rays do have to be pretty good for the AI to perform, we see that on the distal of 3, a bit of an overlap here. And we still saw that Pearl, this patient came back 13 months later, said, hey, do you want to open this up? X-ray wise, not drill wise, and take a closer look. We do see some overlapping, but there's also shades of gray that the AI picked up. And they found that we saw this progression in just 15 months, right, through that DEJ. So in addition to having all kinds of ways to present dentistry, we have incredible printouts. So this would be a great way to send via email to a patient, also send over when the patient's walking out the door. We used to send them, a financial arrangement. It was like a 2-surface composite with all kinds of MILF, weird, strange things, right? And the patients are walking out. They didn't accept the dentistry. And I'm not sure why I used to think that giving a piece of paper would help them call me back. But we are seeing that this page on top of a treatment plan that we're presenting is also very helpful for teams. And then also Trinice will probably share with us a little bit about how the SOTA Cloud team has taken another step further and helped organize ways for you to manage referrals and send x-rays out and manage that care that's coming back into your system. And how do we stay on top of the root canals we recommended and the crowns we need to restore? So they've done an incredible job in that workflow. So we'll lean on Trinice to answer some of those questions in just a moment. So we talked about, like Dr. Kagan was saying, how you can use AI in your practice. We've seen so much research on that case acceptance. And inside of Pearl, second opinion, it's a very easy way to, click into a button, open it up. The images don't have to be uploaded. It's live in real time. And so it can be done in any operatory with a single password. But also where some magic has occurred is when Pearl and SOTA have partnered, and we have the ability to take all of Pearl's functionality and put it into SOTA Cloud's existing imaging system, right? So what does that do? You don't have to worry about change management anymore, right? You don't have to worry about, do we have a, where's the password, right? Or all the magic that occurs inside of Pearl, it's still easier when it's inside of an imaging system that you're used to, right? So you're used to viewing, you now turn on AI, and you have everything ready for you right then and there. And I think that's where we're seeing ease of use, patient chair side, it's already right there in front of everybody, and being able to have that right at your fingertips is really kind of the game changer for AI in dentistry. So back to you, Dr. Kagan, what do you think about having that embedded into SOTA Cloud? I mean, realistically, when we use Pearl versus having that native integration and the combined solutions, what are your thoughts about that? How can you help us understand how that ease of use is?
Can I go into a little bit of my story, that the history
Love it.
of how I came upon all of this? So I was
Please.
moving my practice, and I was using Apteryx, and I had remembered I had heard about SOTA Image before, and I knew it was cloud-based. When I moved to this new office, none of my sensors worked, and I was freaking out. We had patients, we had chairs, we were trying to go live, and we had no X-rays at all. So I contacted SOTA because I remember they had a cloud-based system, and there was not a lot of them at that time. And they got us up and running in like 2 days for all of our sensors, all of our drivers, all of the software. Everything was fine. I was extremely happy with the simplicity of the software. We had been using Apteryx since we got our first digital sensor, and we used I think it was called XV Lite, the most simplest version, just because you don't need all this craziness, in my opinion, to do your X-ray diagnosis. So I was really happy with the interface on SOTA Image. I was really happy with the ease of use. I was happy that you could pull it up on any computer anywhere I was. So just in general, just very, very happy. And then I became aware of Pearl. I'm not sure if it was a year later, or it's pretty much when all the AI software started coming out. And I was at another meeting somewhere, and when I heard that Pearl was going to be native inside of SOTA Image, I was very excited. I immediately signed up. These processes, I will say that they take a little bit of time getting your server up and running, but once they are, once again, it worked seamlessly, and like Sheela said, there's no change management. I would just say it's embedded in the software, so you don't have to pull up another window. You don't have to go anywhere else to look at it. Do you want me to jump ahead to my favorite thing,
Yes, sure.
Okay.
Please do.
And so now my very, very favorite thing now is because I get a lot of guff from my manager, is that her favorite question is, do we have to do this manually? I have that playing on autoplay over and over in my head, because I go to all these meetings, I see all this cool technology. I want it in my practice yesterday, and the issue is, are there things that are going to have to be done manually in whatever new process or procedure we choose to do? And when I saw Office Intelligence and the tools inside of that, and that's a component of Pearl, that basically it takes all the data from Pearl's X-rays, and it takes the previous doctor's diagnosis and potentially a future doctor's diagnosis, and it puts it all in one place. So what I mean by that is, when you're trying to have doctors focus on something and hygienists focus on something every day when they come in, you do a huddle. Well, before this tool, there would be every hygienist would have to go through all of their charts and all of their x-rays and all their previous treatment plans. Every doctor would have to do the same thing. And now these two softwares together just put that all in one place every day. I don't even know if it's with a push of a button, but it comes up with, for every provider, exactly what is on that patient's existing treatment plan, what the AI has diagnosed, and it immediately focuses the doctor's attention on what they need to do that day or look at that day. Which patients need to, does the hygienist need to have them come in to do an exam? Which ones they don't. So that's my absolute favorite, because I can answer my manager's question of no, there will be no manual work done by anyone in order to accomplish it. And then it comes down to at this point, there's no more excuses. You know exactly what you need to do every day. You need to exactly what you need to focus on, exactly what you need to talk to each patient about. And then the doctors need to see if they agree with their last diagnosis of the same patient. Has it changed? Do they agree or disagree with the AI? And if it's a new doctor, they get a ton of information because they get the old doctor's diagnosis, they get the AI diagnosis, and they get to do their new complete exam. And everything's all there right in front of them. So that's my favorite thing right now.
I love that. I love that. It's such a great testament, because it is really challenging to have a staff member look through every single chart, right? And so it's very nice to have AI and Pearl and other systems that are able to just go in and say, hey, let me do this for you. Let you focus on other things like patient engagement, right? Let's talk to the patient more. Let's present the dentistry before they walk out the door. So in practice intelligence, before a patient ever arrives, our team will go through a full chart audit, look at the last 18 months of radiographs, tell you per provider which patients have unscheduled dentistry in your chart. But also, like Dr. Kagan was saying, if we find a cavity on a radiograph over the last 18 months, we don't see a treatment plan that would take care of that. We're going to alert your doctor in that predicted column that Pearl's predicting an area that we'd like to know if you want to move that to the treatment plan. So a lot of teams are reporting that, they've done morning huddles, they still do morning huddles, or some don't, but they now have a roadmap for each provider to go through their day, increase same-day dentistry, and also move through filling those cancellations much easier. So I think you already answered these questions about how, AI can help you with those time-consuming tasks. And also, if there's anything else advice-wise that you would recommend as far as your workflows.
I'll just the second part of this question. I feel like I like to be a leading edge dentist when it comes to tools, technology, however, whatever. Kind of as you go through and get more and more years under your belt, you kind of know like what the learning curve on some of this stuff is. Like I wasn't the first person to have digital radiography at all. That's been around for years. I still don't have I still don't have any milling machines, but I'm gonna go into this new Sprint Ray Midas printer because I see the simplicity and the ease of it, as opposed to I'll just call it the trauma of learning these other techniques and how much time it takes. So I feel like with this, as soon as I saw it, I just had like a few questions. Does it do this? Does it do that? And then I just pull the trigger. So I guess my implementation curve is a lot faster now because I kind of know what I'm looking for. And I would say all of these things are absolute no-brainers, whether you own the practice and you're the dentist, or whether you have other doctors working, or you have a lot of hygienists. No matter what your scenario is, I can only see this as a very added benefit value, super time saving. And yeah, I wish I had it long ago, because I would have I just think, as we spoke about earlier in this discussion, dentists have to be, the owner, manager, technician, radiologist, and clinician, and everything else in the practice. All this does is it allows you to focus better and spend your time more wisely. With I mean, I used to say the only job a dentist should do is diagnose and treat. Now you have like a little helper for your diagnosis. And by no means do I accept the AI diagnosis, because there's a lot of stuff in bones sometimes, on teeth, like Sheila said about water spot. There's a million things that are not pathology that it comes up with. But if you know what you're looking for and not looking for, what it's really good at is looking for the subtle things, or finding the subtle things that on first glance you just might not see. And I think it's for younger doctors, I think it's especially helpful for that. So that's what I would say.
Excellent. And you are managing from afar. Tell us a little bit about that.
I mean, yeah, I mean, it wasn't, I mean, I don't want to go to the whole backstory, but I like to travel. I've been practicing 25 years. I kind of felt like, I mean, if you want to go to the real story, one of my good friends sold to Heartland many years ago. I met with Heartland, and I was like, the deal they were going to offer me. I just thought to myself, I've been doing this for 25 years. I can just not be in my practice very much, and I can do this better than they can, because they don't have any dental knowledge at all. Like, and that was about 16 years ago. And then I just learned what I had to do that. And I was outdoors half of every day back in those times. And I got the urge to be outside all the time. Like, I just wanted to be outside all the time. And so I tried to learn what I had to do to run the practice that way. These kind of tools are just like on steroids of helpfulness, from the standpoint of, we have doctors meetings, and I'm able to pull up all the images. I take screenshots of them. I know the patient's name. I have all their records, whether they're their digital scans, their x-rays, their photos. I have everything at my fingertips. I can review the patients. I can go over them with the doctors. It's so simple and easy. Without these tools, you can't really do that. And yeah, they can be sent to other practitioners, whatever you need.
Excellent. I love your story. I love you having the best life you could ever want, as we want for every dentist, right? That is the goal.
Yeah.
You know, kind of have
That's the hard part.
technology.
Figuring out what you want. That's the hard part. And then deciding that you're willing to do whatever it takes to get there. So that would be my suggestion on that.
Excellent. Excellent information. Well, I think that you already went through kind of Pearl's final practice intelligence features about color coding an entire schedule for your doctors based on opportunities. Again, I think that one of the hardest things for me to solve as an office manager at the time was, oh boy, I have 3 openings today, but I have a full staff. I still have to manage and run through my day and check out patients and present dentistry. Can Pearl help identify areas for me of patients that are coming in today that I could have them stay? And using a color-coded feature, keeping it simple, right? Having click one button and you can see all of your patients on your restorative side that are in your practice today that don't have an upcoming hygiene appointment and they're overdue. Could we slide those into the hygiene side? And I think these are things that we're going to have to lean on as that virtual staff member, so that we can, again, continue to focus on our relationships and also focus on having the unfortunate lack of staff in the practice. I think insurance automation is probably the next thing to be thinking about in a practice, because it does save your team time, looking at all of the patients over the next 5 days that are on your schedule. So future capabilities, I will end with this slide because I want to make sure there are question and answer time for Dr. But also imagine using this predictive analytics. This does not exist in Pearl. I always have to have that disclaimer. But we look at it from a bone loss perspective. But what about looking at lesions of decay or periapical lucencies? It'd be nice if we could have this to be able to make that final decision, when to watch, when to treat. And I think as we see AI and where it's going, we will have more and more opportunities to have things streamlined, like treatment planning. Imagine hovering over something and it would pop up like, do you want to put a filling in here or a crown, or do you want to do nothing? Right. And I'm learning a lot about the systems that are coming out, and Pearl's working on also being able to transcribe information that you have inside of your operatories if you would prefer, and also note taking. CBCT will be a huge space for AI. But before I put up our QR code, I do want to stop here and also see, Trinice, if you have some couple stories or any insights you want to share with us on some of your key users. I know when we were back learning how to train SOTA together and AI, you were such a superstar. And kind of what has been some of the experiences that you have both with an onboarding perspective, some of your client feedback, and can you share a little bit about that incredible side of SOTA that allows that referral source that you guys have been working on?
Absolutely. As far as the referral source, we do have dedicated portals specifically for patients, giving that ease of access to their images when they do ask for it. But also on the flip side, from a referral perspective, and we get to accommodate both sides, even through that same workflow. So when you're sending out a referral, you can also give access to the patient images as well. Key parts there is that as long as you go ahead and share those annotations with the patient during that case presentation, that can get brought to those portals. They can see that in the comfort of their own home. And if they don't happen to schedule an appointment there, within SOTA Cloud, they'll have the ability to at least submit a request, which is pretty helpful because if they happen to have left with no treatment and they're looking back, they're ultimately being held accountable for what they should be coming back in for and getting scheduled for an appointment. I would say also to add, tooth parts gets everyone, whether it's patient or whether it's first-time users with Pearl, tooth parts definitely takes it a long way. And you and I always speak about that because when we're bringing down the anatomy of the tooth, I mean, we always think about our learning dentistry times where we're actually looking at the anatomy of the tooth, bringing that color coordination within books, but now we're really bringing that into play when it comes to patients, and that does go a long way. We're all patients here, so it's easy to explain that.
That is a great point. You're absolutely
Exactly.
right. I love that. It's so true. And it's been such a great partnership to be able to have that, again, simple way for your teams to be able to click a button and stay in their own imaging system. Small little Pearl plug, if you are interested in the Pearl software, this is a great QR code for you to go ahead and click to get a customized demo for you. Bring in your office managers. Maybe they want to look at the practice intelligence features Dr. Kagan's talking about, as well as the new insurance verification. Trinice has a great code also in her background for the for the SOTA team. So if you'd like to schedule, isn't that with you also, Trinice?
That is with me.
Yeah, and so that would be a really great one to click on that QR code as well, so that the team has time to talk to you a little bit more about all of their features. I'd like to open this up to questions now, and make sure that you have some time to ask Dr. Kagan these, what are you thinking about, while you're sitting on this webinar? What are some things that you've had in your mind that maybe you'd like to find out about integration or ease of use or accuracy? It's much better to hear from a user than a Pearl or a SOTA person, right? We're a little biased. So I'm going to open this up for questions. I hope you take the time to ask some questions. Kimberly, if you're still here, I'd love to have you back on. Kimberly is also available for any additional information if you guys have any questions or concerns. When you are scanning your QR code for your CE, please make sure you know you need to use the Pearl is the password that they're looking for. And then also that this will come, the CEs will come from CE Zoom, not from Pearl or SOTA. So that's kind of important. Let's see. I think I might have a question or two. I hope. Hopefully, Dr. Kagan, let's see.
Eric had their hand up and I'm not sure if Eric had a question or not. So Eric, if you do, I'm going to lower your hand. If you want to speak, you can raise it back up and I can allow you to speak.
Yes, we would love for you guys to ask any questions you have. This is a great time. One of the main reasons I loved having Dr. Kagan here tonight, and I'm super thankful that he chose to spend his time with us, was that he's like, I have to just tell the truth, Sheela. And I'm like, that is what we need. That is why we have you here. We want you to tell the users and those of you that are on the webinar thinking about including AI into your space. It's not really just a buzzword, right? It's actually, like we were seeing, AI is in our world, and it can really be beneficial for those of you struggling with staffing issues. I know one of the themes that I was working on inside the Pearl product back in the day was, can you show us, like with a click, which patients need to do x-rays? Because we used to have somebody in our office that would look through every single chart to make sure that every single bite wing PA, FMX was actually put onto that chart for the hygienist, right? And also, if that little indicator is still there the next day, that means that maybe you took the x-rays, but they weren't billed out. So it really kind of works as a checks and balances. We took that person and she became our concierge. So she would walk around and make the dental experiences better, help with time management. So there's a lot of really huge gifts for your office managers, your clinicians, increasing same-day dentistry, and your patients, ultimately. I have a question here that's asking about Pearl in Canada. So yes, Pearl does exist in Canada for the radiologic side. And the question was, when is Practice Intelligence coming to Canada? And I don't have an answer for you, but we are actively working on that. So I love the questions. Any other questions for myself or Trinice? Dr. Kagan, is there anything else you want to add for anybody that's on the call? I know you already shared so much, but.
I mean, there's, as you were just alluding to, it's not just what's on a treatment plan for that daily huddle. It also shows, who needs x-rays, who needs which x-rays. And so it's prompting the team to get the necessary records that are due that day. Also, there's a lot of other parts that we've just only started to explore, where you can funnel your entire patient base for any type of procedure that's in the diagnosis of. So like if you're looking for patients who need implants or patients who need Invisalign or whatever procedures you've diagnosed, there's a very quick funnel section that you can click through there and find those and create a list for your team to reach out, or you can even upload those for emails or whatever. So it slices and dices your data in a different way that I've seen before in other softwares like Dental Intelligence or other things like that. But so I feel like it's more usable, that you can take this data and use it in a way that's going to be helpful for your practice.
Excellent. And I think we had another question about the SOTA native integration. I don't know if you saw how famous you were, Dr. Kagan. You were in SOTA.
You know who showed it to me? My team. That's who showed it to me.
Love that.
I don't know how they saw it, but yeah.
You are big time here. But I think also like this simple, I am big time, by the way. My name is in the demo, right? So I don't know, we have to rival here, but I just want to make sure everybody knows like how simple these small little dots tell you right away that there's something to look at, right? And SOTA Pop, I think I was telling you about earlier, that you have all these functionalities inside of Pearl, and this is live in real time. Again, my favorite ever is tooth parts. So I do think that hopefully tonight your team has seen that also when you're reviewing these images, one simple button, you go back to your regular imaging system, right? Hopefully tonight your team has seen ways to integrate simple, easy tools to relieve these crazy burdens that we have on our daily workflow. We'd love to hear from you. I think there's another chat here. Anything else, Kimberly, that you would like to add before we?
Well, just if anyone was curious about the benefits of having Pearl inside SOTA and the benefits of SOTA Cloud, Dr. Lohman left a really beautiful testimonial in the chat. And so Sheela, feel free to read it out. But I wanted to that's the other kind of quote unquote question, but it's awesome. So.
Dr. Lohman, I didn't even know you were here. If you're still here, thank you for coming. A celebrity in the space with Dr. Kagan here. We've got 2 celebrities tonight. She wanted to let you know that they also use SOTA Cloud and Pearl in their practice. She loves to see the radiographs from anywhere. The integration makes the workflow efficient and easy to use. There's a small learning curve, not difficult. Take the time because it will be one of your best decisions you'll make in your practice. So I believe we will be hearing from her soon. Just a little foreshadowing. But I love your story too, Dr. Lohman, because it's just very similar to the doctors that have embraced AI, not thought about, back in the day, people would purchase AI and say, I just got it to see if I was better, right? I used to laugh. I'm like, that's funny. You should know that you're better, but you should know that we're better together, right? So it's kind of like a superhuman. And again, there's so many incredible features, but also having that natively directly in the workflow really helps with taking away that change management or the integration of how do I have to train my staff and all that. You just have to learn a few colors, and after one x-ray, it's pretty much a done deal. So we're always available. Dr. Kagan, I cannot thank you enough for taking time out of your day and meeting with me before this and also tonight. I know you had other things going on.
I want to say one more thing. I'm pretty critical about everything, just everything in general. And most things have like pluses and minuses, right? What's the advantage, disadvantage? You're always weighing those things in dentistry and life, always making these things. I feel like I don't have any complaints about either of these softwares, and I just have praise for it. So to me, that's a really high bar for anything, whether it be software, a tool, a process, a lab, you name it. I don't see a downside. I don't see a downside to this at all. So yeah, I mean, it costs money, but so does everything. I think it's the value far outweighs the cost. So that's where I would leave it. So yeah.
Excellent. And he was not paid to say that.
I'm not paid.
Yeah, he literally volunteered, guys, his time. So another incredible human along our journey. Thank you again so much, SOTA team. Thank you, Kimberly, also for all of your help. Most importantly, thank you to all of you that chose to spend your evening with us. And we are here to support you wherever you're at with AI, Pearl, and SOTA. We hope you have a wonderful night, and we hope this webinar was fun for you and that we see you on future webinars. And again, I'll debut Dr. Lohman, hopefully, and we will see you guys soon. I keep looking at the chat to make sure that I answer all these questions, but somebody said thanks, and thank you for joining us and hearing about Pearl and SOTA Cloud. Dr. Kagan, you are the best. I'm sure we'll be chatting soon, but thank you again for coming this evening. And Trinice, I'm sure we will see you again soon.
Thank you, Sheila, for having me.
Good night, everybody. Have a wonderful night.